Okay, yes, thank you very much. Today, as St. Joseph's Hospital, Kitgum, we are pleased to have received a generous donation of uniforms, and in the medical language, we call them medical scrubs. And scrubs are uniforms that we wear in different workspaces. Nurses can wear them, doctors can wear them. We can use them in theater, we can use them on duty in the different medical, surgical, pediatric, outpatient, and the maternity wards. They are uniforms that provide protection to staff, but also provide identification to staff. As we work in a medical setting, we are exposed to infectious agents in the course of doing our work, and we cannot work in our own clothing. So these uniforms help our staff to dress in them, protect themselves from acquiring infection that they can carry home, and should be used routinely. So today as a hospital, we received a consignment from a friend of the hospital in the names of Mr. Mark Joseph Ocheng, who lives in the UK. He's born of Kitgum and supported us with these scrubs to help our nursing team. This is a generous support to our hospital because it came without us even planning for it, but out of his generosity with support from his associates, he brought for us this uniform. So we are very, very grateful and very appreciative. And on behalf of the hospital management, staff, and board, I'd like to extend our warm appreciation to Mr. Joseph Mark Ocheng for the generous donation of these scrubs. As a hospital, we make uniforms for staff. We also make other requirements for staff available, but when we get a donation, it relieves us of that cost, because for you to make a uniform, you have to spend money. So when you receive a free consignment like this one we have received from Mr. Joseph, it is a relief. It means the money that we should have used to buy clothing for us as employees is saved, and that money can be channeled to another area of need. And in this case, we can even use the savings that we'll make out of this donation, the money that we would have used for buying clothing, for buying drugs. We can even use it for paying the electricity bill. So meaning when we receive a donation, it relieves an expense that should have taken place in another area of health service delivery. So Mr. Mark, we want to say thank you very much to you and your associates for donating to us these scrubs. We look forward to many more other donations from other well-wishers of the hospital, because through partnerships we can support healthcare. Healthcare is very expensive, and for a patient to get complete a service, it entails a lot. And most times as health facilities, we don't charge the exact cost of care that a patient should pay, meaning donations come to subsidize the cost of care to patients. So the more donations we receive as a hospital, the more cheaper or easier it will be for patients to access care. So we call upon many other well-wishers to support. You can support by giving drugs, you can support by giving equipment, you can support by giving clothing for the healthcare workers or other protective gears. You can also support technically by giving technical expertise to the hospital, and all this contribute to a reduced cost in healthcare service delivery. So we say thank you very much to Mr. Mark and his associates.